once you have your username and your password, you can log in now. Okay, so this is how the Videomed will look, Videomed Global, once you log in. So the very first thing that a prescribing pharmacist or a doctor needs to do is create a new patient profile. So when a doctor creates it the first time, they don't need to create it again. So once a patient is on you, they're on you forever, and you won't need to do double the work for when the patient comes for their follow-up. Okay, so let's go to create new patient. So this is just where you put in the basic information of the patient. So you can use one of the following. So let's put in the NHS number. This is just the identifier. So let's create a NHS number. So let's do first name, patient, gender, say male, and date of birth. Let's say. Obviously, if your patient is a baby or an infant, you will need to put in the parent or the legal guardian's information over here. And now you need to put in the patient's email address and phone number. So let's do that. In the phone number as well. Let me get that. And then you need to put in the patient's street address, so their place of residency. Okay, so once you fill in the patient's address over here, it will automatically fill out over here as well. So now what you need to do is you need to choose the payment information. So always choose cash since so the patient can either pay through CareLink or they can pay via a link that I will show you how to send to the patient. But once the medical professional has added all of the patient's information, it's time to save it. So you just click that save button in the green block and it has automatically saved onto Videomed, and the doctor or the prescribing pharmacist will not need to do this again when the patient comes for the third, fourth, or fifth time. Okay, so for now, let's go straight to the health assessment. We'll come back to appointments in HR, but usually right after a patient is information is added, we move straight on to the health assessment. So for every single new consult, it is obviously a new health assessment. Okay. And if you look right next to new health assessment, you'll see history. So this will show you any previous health assessments that has been done for that patient. But let's go and create a brand new one. So let's say the patient is experiencing sinusitis. So you'll put the symptoms of the patient over here. So let's say and now, any chronic conditions. So, does your patient have any chronic conditions that you need to be aware of? We have a list over here that you can choose from, and you can choose multiple at a time. And does your patient have any acute conditions? So, any acute conditions goes under other conditions. Medication. Is your patient on any chronic medication that you need to be aware of? You can keep a record of it under medication. So, has your patient had any procedures or surgery done? And if they have, you can keep record of it under the surgical history field, and you will need to put the month and the year that they had this surgery or procedure. Allergies. If your patient has any allergies, we have a list of allergies over here, and you can click multiple at a time. If they do mention an allergy that's not listed over here, that's completely fine. The medical professional can click other and they will just need to specify what that allergy is. So vitals. So the doctor or the prescribing pharmacist needs to put in the patient vitals over here. And once they do this, it will pull through and it will show up on the EHR as well. If the country that is using Videomed does not need an ICT code, you can ignore this section. Okay, so let's put in the ICT code and let's click search. So acute sinusitis does pop up. So you just click the correct ICT code and then you can move on to the outcome of the consult. So are you prescribing them a new treatment? Are you recommending a face-to-face consult? Are you referring them to a specialist? So whatever the outcome is of the consult, you have a list of here that you can choose from. Okay, so now it's time to send the consent link to the patient. Okay, so it will come through as a message, and the patient will have to digitally sign it. It takes about 2 seconds to do. It's very easy. So all you need to do is send consent link to patient, click that, and just wait for the consent link to be sent to that patient. So I'm going to sign it on my side as the patient. Okay, so I've just signed the consent link, and the practitioner can see if the patient has actually signed it by clicking check consent status. And okay, it shows consent signed as well, which is good. If the patient doesn't have a phone with them, it's completely fine. The practitioner can override the consent. So to do that, all the practitioner needs to do is click override consent and needs to put in the new cell phone number that the patient wants to um, send the consent link to and needs to sign. So yes, but now we can see that the consent link is signed, and the practitioner can save the health assessment and the notes. But if you can see at the bottom, it says patient notes in this orange block. So if the practitioner has anything additional they would like to add to the health assessment, they can type it under patient notes, and right next to patient notes is my private notes. So this is anything confidential that your patient tells you. You can keep it under my private notes, and it will be confidential, obviously, and nobody has access to these notes. Okay, and then once the doctor or the prescribing pharmacist has completed that, they need to click Save Health Assessment and Notes. So let's just wait for that. Okay. So we can see now under history that on the 11th of May 2026, a health assessment was done and it was successfully completed, and the patient had signed the consent link. And if the medical professional wants to go back and look at the self assessment, they can do it. They just need to access the patient's profile. Okay, so let's say now that the patient needs a script. So the script template. So let's say if the patient needs a script, the script template is located right next to the health assessment. So let's go there. Okay, so it will have the doctor's information already, or the prescribing pharmacist, or the medical practitioner. The patient's information will be on there already. The medical professional just needs to put in the ICD code, the medication, the dosage, the form, and the instructions. Okay, and then they need to save and email the prescription. So let's create a fake script today as an example. So we said that the ICD code was J01, sinusitis. So let me just find a medication. The medical professional can put the medication name or the active ingredient. It doesn't matter. Both should pop up. The medication name should pop up when um, the either the name is typed or the active ingredient. So then the dosage for that, let me just get that. So 1 tablet. So the form will be in a tablet 3 times a day after meals. Use as directed. Do not substitute. Complete the course. And since it is an antibiotic, we're doing 0 repeats. Okay. So then if the doctor or the medical professional wants to add any additional notes, they can do so over here. If they want to add another medication to the script, all they need to do is click this plus sign in the blue circle and then repeat the process. But if they want to remove a medication, they need to click this trash can icon over here in red, and it will remove that medication. Okay, but now we need to save and email the script. So the medical professional will click that, and the medical professional needs to sign over here. Okay, and then an OTP will be sent to the medical professional's mobile, and they need to enter in that OTP. And then once the OTP is entered, we need to click NPA. Okay, so now we need to put in the pharmacy address. So let's get that. Okay, so obviously you will ask your patient what pharmacy they would like the script to be sent to, and whatever pharmacy they choose, you will need to put in the pharmacy's postal code and it will pop up. So let's just choose the first one for the training video. And now you need to send the pharmacy the script. Okay, so it will include the doctor's email. You can remove that. You can also include the patient's email, and then it will send it to the pharmacy, the chosen pharmacy. And then once you are ready, the medical practitioner can click send, and then the patient will be able to get their medication. And every single script is password protected, and it will be the patient's date of birth. Okay. So if the patient needs a sick note, the sick note template is located right next to the e-script. So let's go there. So all the medical professional needs to do is add the date that they've been off, the patient's been off. So the patient has been off the 11th of May and will return the 13th of May. And then the medical practitioner will need to put in the ICT code. Once the medical professional has done all of this, it's time to click submit. Medical professional needs to sign and an OTP will be sent to the mobile phone of the medical practitioner. So let's get that. Once the OTP has been entered, the medical practitioner can click save and it will give you an option. Do you want to download or email the sick note? The practitioner can click email and send it straight to the patient. So let's go to the referral note template. So the referral note template is located right next to the sick note template. So let's go there. It is a very simple and easy to use template. It will have the medical professional's information on. All the medical professional needs to do is to add the specialist details and over here, obviously put the motivation or the referral why the patient is being referred to a specialist. And then once the medical professional has done that, they can click submit and they will need to sign again and enter in the OTP. And then the medical professional will be able to email the referral note to the patient and to the specialist. So once the medical professional has completed the referral note, it's time to move on to pathology. So once the medical professional has drawn bloods and the bloods have been tested, it's important now to organize the patient's blood results. So to do that, we go to the pathology section under Videomed Global, and this is where we upload the patient's pathology results. We do this just to keep it organized. I know sometimes a medical professional can have so many patients' blood results in their folder, and just to be able to access it easier, we advise that medical professionals upload a patient's blood results underneath their profile on Videomed Global. So to do that, we go to the pathology section right next to referral note, and the medical professional just needs to click select a file. It will take them directly to their files, and then the medical professional will need to select the correct patient's blood results. And the medical professional will be able to view these blood results anytime at any place. So let's go to my appointments. So as I said, when a doctor registers for the first time on Videomed Global, or let's say a prescribing pharmacist registers on there, they are automatically added onto CareLink. So CareLink is a booking platform that patients book appointments through. And when a patient books through CareLink with a particular medical professional, that appointment will pop up over here. Okay, but for today, we can see that we do not have any appointments for May 11th. Okay, but let's say if a patient did book with me, it will appear over here. Okay, let's say I want to also manage my availability. Let's say I want to take a break during the day. Then I go to manage availability. So let's say I want to take a break at 12 o'clock on Tuesday. So I just click that 12 o'clock block and it will say you'll be marked as unavailable for Tuesday at 12 o'clock and confirm it, and I'll be unavailable for a half an hour. So for 30 minutes I will not be able to see any patients, and it will also show on CareLink side that I'm unavailable and that a patient must not book me for 12 o'clock. If I want to take leave, I can scroll right up and I will need to select a date from the calendar of the date I'll be on leave. So let's click update. So let's say I am going to be on leave in May 2026. So go to the correct month. Let's say from the 13th of May, and I will be back in office or back in the pharmacy the 20th of May. Okay, update. But that is Videomed. It's super easy and super simple. So now I'm going to show you what to do when a patient comes for a follow-up and how to access their profile. So let's log out and let's log back in again. So when you log back in, it obviously will come back to the screen. So let's say a patient has come for the second or third time, so it's their follow-up, and you created their profile on the first visit. So now you need to find their profile, okay? So you need to go to find existing patient, click select search type. You can use one of the following to identify your patients. I always suggest using the patient's last name because it's quite easy. And then under search value, you put in the patient's surname. So let's say the patient for today is Adams. So put in the patient's surname, click search. You can see Siraj Adams pops up, and then all you need to do is click select patient, and it will take me directly into the patient's profile, and then I can continue with the consult. So that is how Videomed works. If you have any questions, please contact the Videomed Global Operations team.